why I'm a hard no on colonoscopies, and what I do instead. I said what I said. Colonoscopies are a hard no. Let me break it.
This is a really harmful and irresponsible video for this person to be making because colonoscopies are a really critical way in which we identify early colon cancers, and the incidence of colon cancer is actually increasing, in particular among younger people. So in this context, for someone to say we shouldn't do colonoscopies is particularly wild.
First of all, you're drinking a toxic prep solution that wipes your entire gut flora. That's your immune system. Poof, gone.
There actually is some truth here, which is often the case with people like this, that they leverage some small amount of truth to then sell you on a whole bunch of lies. But in this case, the truth is that when you do drink the prep, it does temporarily change the microbiome in your colon. But it's temporary. In most studies, it's back to normal within 1 to 2 weeks. The other piece here that she gets totally wrong is suggesting that the microbiome in your colon is your immune system. And that's one of the ways you know for sure that this person is not a real doctor. Our immune system is actually super complex and fascinating. Without going into too much detail, I'll just say that when we're born, we have a lot of our immune cells in our thymus, which then involutes over time. We also have immune cells in our spleen, in our bone marrow, and indeed throughout our blood. So our immune system, and of course in our lymph nodes as well. So our immune system is kind of everywhere. And to state the obvious, a colonoscopy is not going to wipe out your immune system.
Then they infiltrate your colon, scrape the walls, and introduce bacteria that isn't supposed to be there through micro tears, creating a poop storm.
I don't know if she thinks poop storm is the technical term, but as someone who has done a number of colonoscopies, I can assure you that there's not really scraping that's done. What does happen though is if we identify a polyp or another abnormality, then we may biopsy it. So we may, in a specific location, intentionally take a piece of tissue so that we can send it off for testing. But we're not scraping the entire lining of your colon, as she seems to imply.
Let me tell you, the infection risk that you'll never feel is called routine, but I call it reckless.
Infections can happen after colonoscopy, just like after any other procedure, but they're very rare at about 0.1% of the time.
And for what? To find something that took decades to develop while doing nothing to address why it developed in the first place? Duh.
Most cancers do in fact develop over many years, and if we could detect them earlier, we would love to do that. We just don't have the technology that allows us to do that yet. At the same time, we obviously encourage people to live as healthy a lifestyle as possible to try to prevent the development of any medical conditions. But we do not, unfortunately, have total control over what happens to our bodies. And despite our best intentions and our best efforts, cancer can still happen. As a side note, I did notice she says that colon cancer doesn't start in your colon, but that it starts in your gut. Gut is, again, another technical anatomical term. I'm sure she'll explain it to us someday.
So instead of healing the terrain, we are told to screen and wait, just like ticking time bombs.
It's not really a ticking time bomb when you're actually monitoring what's happening so that you can intervene before anything bad might progress. One might suggest that a ticking time bomb is when you do absolutely nothing to identify tumors and other abnormalities that might happen. The commonality for this creator and others like her is that they're trying to sell an illusion that we can control our health. And though it's true, again, that there are certain things we can do, we can make sure we're adequately hydrated, we can make sure that we're getting enough fiber, we can make sure that we exercise, and we can make sure that we're not overindulging, and so on and so forth. But there are a lot of things that still will happen to us in our bodies, even if we do all of that right. And what they are selling is an illusion of control that simply does not exist.